Good day, I'm student nurse Angelica Contreras from BSN1 11C Group 9. Today, I'm going to conduct a history-taking and general survey. To start off, I'm going to do a nursing interview with a patient in hand. To have a brief overview, a 20-year-old female patient who is an online seller was admitted the day before the assessment due to fever, cough, and difficulty of breathing. Before we are going to meet our patient, we are going to prepare all the things that we need. First is we will clean our area and do a proper hand washing to deter the spreading of microorganisms. Now that we are done, let us meet our patient. Hi ma'am, good morning. I am student nurse Angelica Contreras from Davao Doctors College. May I know your name and age?
Hello ma'am, I am Jaya Ventura. I
Mhm.
am 20 years old now po.
Okay, and how would you like me to address you?
You can just call me Jaya. My friends just refer to me.
Mhm. So, hi Miss Jaya, can you hear me well?
Yes ma'am.
Do you know why we're here today?
Yes I do, but I'm not quite sure.
Mhm.
I've been so weak this past few days and I really need to get to my work and I just want to be checked up on.
Okay, so for me to be able to help you, I need to understand the situation that you're in right now. I'll just do a quick health history assessment and just verify some info about what you're feeling. This will involve me asking some personal question about you and your health to help us figure it out. Is that okay with you?
Yes ma'am, yes it is.
Okay, so did you already eat?
Yes, I had my lunch earlier.
Okay, do you have someone to accompany you here right now?
I actually have my sister with me, but
Mhm.
I told her to go outside.
Okay.
My father is quite busy, so it's just us now.
Mhm. So before we start, I have to check your details. So your name is Jaya Ventura. You are 20 years old, a Roman Catholic from Davao City. Is that correct?
Yes, that's right.
Oh, you're from Davao City. Are you okay with the language we're currently using right now, or do you prefer using Bisaya dialect?
Um, English is okay for me. I'm used to it now.
Mhm. Are you comfortable right now, ma'am? Do you need anything? Or do you want to urinate first?
Can I have a glass of water? My throat is kinda itchy.
Oh, sure. Here, ma'am.
Thank you.
Do you need anything else?
No, I'm fine now. Thank you.
Okay, so we'll start now. Um, Miss Jaya, can I ask for your birth date and address?
Um, I was born on December 31, 2001, and I currently reside now at Talama District.
Okay. In case of emergency, who can we contact?
You can just call my sister. Do you need her phone number?
Yes, we need.
Her phone number I think is 0944 6328102.
Okay. Are you still studying right now, Miss Jaya? Do you go to school?
Actually, I didn't continue my study.
Mhm.
I've been doing my online selling now to help my father.
Oh. Can I ask if do you have any allergies? Are you allergic to any food or medicine or anything else?
As far as I know, I I don't have any allergies.
Okay, so let's move on, Miss Jaya. Can you tell me what's going on? Can you tell me why you're here?
Actually, I have a fever for quite some time now, and I actually cough from
Okay.
time to time, and I sometimes have troubles in breathing because of it.
And how long has it been since this fever started?
I'm not quite sure. I think about 2 to 3 days ago.
Okay. Can you tell me what you're feeling right now?
My head, it actually hurts sometimes. Like I can describe it like I have lots of things I carry in my
Okay.
head. It's very heavy,
Oh,
and I am so out of breath so many times.
okay. How about your cough? Can you describe it to me?
I don't know. The cough is not actually that dry. There's actually mucus in it. For the color of the mucus, I think it's kind of greenish like
Uh-huh.
that, and it's quite thick for me.
Oh. Is there any blood in it?
Um, I don't think so. I don't think there's any blood in it, but sometimes because of it, my throat's so
Oh.
painful.
So from 0 to 10, how much would you rate it as 10 being the worst?
Um, I don't know, maybe around 5 or 6.
The cough, is there a particular time when it is worse?
Um, Actually, I think during at night, especially when I'm about to sleep, it's such a pain, and I don't know, my head always feels heavy because of it, so I couldn't sleep at all because of it.
What makes your feeling better? Do you have any relieving factors, or what do you do to minimize the pain?
So when I rest my back on maybe a high bed rest, it makes my breathing really good. It relieves the pain, and the cough lessens because of it. And sometimes I use water therapy to relieve it.
Okay, that's good. Is there someone that has been taking care of you for the past 3 days?
As what I've said earlier, my father is busy working, and actually my mom passed away a year ago, so it's only me and my sister taking care of me.
Have you ever met someone with fever or cold before having one yourself?
I'm actually an online seller, and I work a lot, like about 10 hours a day or even more. So I meet lots of people every day to pick up their orders, and some of it is I deliver myself. So I don't know, but I think I remember one of my customers telling me that she was not feeling well that day, and that's why she was late on our meetup. But days before that, my father actually went home not feeling well.
Oh. And how do you deal with your fevers before?
Before, I used to drink lots of water,
Okay.
and my fever just subside. It does not even go over a day. But now it's different. Even if I drink lots of water, I still feel so weak. I even planned to tell my sister to buy me some amoxicillin.
Oh. Did you have any other infection?
No, I haven't.
Regarding your medicine, did a doctor prescribe you to use amoxicillin?
Not really. My friends just told me to take this.
I see, but just an info, miss. Antibiotics like amoxicillin is for treating infections and needs to be prescribed by a doctor for validation for your health and for your situation to not make it worse, okay?
Oh, I see. I did not know that actually. Thank you for saying that. Thank you for telling me. I will not,
Okay.
excuse me. I will
Sure.
just tell my sister later on to not buy the medicine.
Okay. So back to your fever. And how did this affect your daily routine?
Um, I really feel so tired. I couldn't even get out of bed for a few days.
Mm-hmm.
I was really anxious because of it, that I couldn't do any work, and that's why I decided to go here, because I really need to do things. I need things to work out and finish all the orders.
Have you noticed any weight loss?
Not really.
Do you suffer from nasal congestion or nasal problems?
Mm, Actually, not. Unless if there's too much dirt or dust,
Mm-hmm.
it triggers my nose.
Oh. Have you been admitted before to any of the hospitals?
As far as I remember,
Mhm.
maybe about a year ago,
Mm-hmm.
that time when I just started my business, I got hospitalized at, wait, where was it? St. Augustine Hospital in
Yes.
Taloma, due
Yes.
to, I think it's because of fatigue and difficulty of breathing as well, and
Mm-hmm.
dehydration. Um, I said earlier that I drink lots of water, but when I started my business, I actually did not have enough time to do it. That's why I really think that's the reason why I got dehydrated.
Okay. I see. I hope you don't mind now, but I will be now asking some personal information. So, I'm gonna ask a little bit about your sexual history. Are you in a relationship?
No, not right now. It's been already months since I last had a boyfriend.
Oh, sorry. How about your sexual life or sexual activity? Are you active?
No, not really.
About your menstrual cycle, can you tell me more about it?
Actually, my period is regular, and I don't have any problems with it.
Mm-hmm.
My period lasts around, I don't know, 5 to 7 days maybe,
Oh.
and sometimes if I could rate the flow, maybe medium to heavy,
Mm-hmm.
like that. Actually, nurse, I have a concern. I
Sure.
actually don't feel any abdominal cramps during my
Yes.
period, and I don't feel any dysmenorrhea
Mhm.
like others. Is that normal?
Yes, it is normal. Can I ask if when is your last menstruation? Your, the first day of your last menstruation cycle?
First day,
Yes, the first
Uh,
day.
January 3, if I can still remember.
Oh, okay. And how about your bones? Do you feel any joint pains?
Not really, but sometimes I'm just weak on my knees when I stand.
Oh. How have you ever undergo any surgeries before?
No.
Any heart problems?
No, not really.
What about other pains or diseases from your family members like asthma or diabetes, like that?
Um, as I've said earlier, my
Mhm.
mom actually died a year ago, and it's because of kidney failure. And I think my dad now was diagnosed with hypertension.
Oh.
But for my sister, I don't think she had any, like, some sort of that.
Okay. Let's move on now. Do you take any prescribed medicine?
No, I don't. I don't actually go to the doctors,
Mhm.
but I take a vitamin every day.
Can I ask what kind of vitamin is it?
It's just sodium ascorbate, the ones you can buy at the local pharmacy.
Okay. I see. Can I ask if did you ever smoke or drink?
No, I don't.
And your diet, do you eat well? 3 times a day with healthy foods?
Actually, I just eat about twice a day because of my work.
Mm-hmm.
Sometimes I skip lunch, especially if my customers are late on our
Yes.
meetup. And I eat a lot of junk foods and
Oh.
soft drinks. especially because I'm outside most of the time and it's easier for me to buy it.
Oh, okay. I see. So, Miss Jaya, let me just summarize what have you told me today. So, based on what you've told me today, you had this fever for 3 days now and you haven't taken any medications, am I right?
Yes, nurse.
And there's no presence of blood in your mucus and you drink lots of water to relieve the coughing.
Yes, yes.
You have troubles in your breathing but don't have any other past diseases, no surgical procedures done, and your mother passed away due to kidney failure while your father is hypertensive. Is that correct?
Yes, nurse. It
Is there anything else you want to add to it?
No, none so far.
Okay. So, Miss Jaya, please avoid buying antibiotic. The water therapy is good, but you have to take medications in order to directly aid this fever. I recommend to have a prescribed medication to one of our physicians. This might be a flu or fever. This might be a flu from the people you have encountered with, or maybe it is because of the working environment that you have. Now we'll just have to take your vital signs so we'll know what to do, okay?
Okay, yes, nurse, I understand.
Okay, so so wait for a while, ma'am. So, do you have any question regarding of what we've discussed today? Do you understand it?
Yes, I understand. I just want to ask when and where can I meet a physician?
So Miss Julia, I'll arrange for it, and we'll make it so it's both convenient for the both of you.
I see. Okay.
So that would be all, Miss Jaya. Thank you so much for your cooperation.
Thank you very much, Nurse Contreras.